very hard for employers in Indonesia now to deal with rising costs of healthcare. The medical inflation is about 15 to 25%, and it's quite difficult to increase the medical budget that high.
Being competitive, to me, it doesn't mean that you have to be cheaper. Being competitive in each market means that you need to be able to offer better for less, which is a combination of levels of coverage, price, and elements that you incorporate to your health programs around the world, such as wellness, culture in your country, culture within your company. So all of this is basically the new trend on how companies need to cope with rising costs.
Given that we have a very low unemployment rate of 2.1%, companies will look to finding ways and means to attract and retain talent.
Employers in India are coping with rising healthcare costs by reducing the kind of coverage they offer their employees, build in some amount of copay, and ensure that employees become more responsible.
We have got different levels according to the grading of the employees. And also, for instance, like in hospitalization, the cost of the hospitalization is different from one to the other's levels. Even the same medication, for instance, it will cost more. Or the same doctors, it will cost more based on these different levels. So that is always a major issue with multinationals, because they cannot understand it, why the cost of the same medication, the cost of the same doctors are different for different levels.
Why is it possible to even think that companies can afford each year to say medical inflation is running at 8, 9, 10%? It is completely illogical. It is unaffordable and it needs to be fixed. And it's one of the biggest society challenges is to maintain and manage health costs.